I can't resist taking an extra 20 seconds and telling you that I was the national medical leader for a company called Truven Health Analytics. And I promise, BJ, that I didn't plant this. You know I didn't plant it. And we also consult for Oscar. None of it, but anyway, they're great clients. Building that database on 300 million Americans provides incredible analytics. We could help start a managed care company, or we could run clinical trials. We could help with that kind of thing, deciding to pick patients who have congestive heart failure, hypertension, diabetes, and who had a stroke, and then run a trial on those. The power of data is I'm going to say transcendent again, because it's just incredibly powerful, but we'll move on. I'm going to introduce Lee Krauss, who's the Senior Vice President at Aon Hewitt Health and Benefits Practice. She's an expert in essentially designing healthcare exchanges, a crucial aspect of healthcare reform. And I could go on, but I'm not going to. Thank you, Lee.
There it is. So actually, we're going to focus here on a little different innovation in healthcare, and this is for employers who are providing healthcare benefits to their employees and retirees. And for lack of a better term, we call them private healthcare exchanges, and that's to differentiate this from public exchanges that I'm sure you're all aware of, where individuals can purchase healthcare. So in private exchanges, what we have done is taken some of the elements of the public exchange, the element of choice of plans, choice of carriers, different consumer abilities to do things electronically, and given people the option to choose their own health plan. So I'm going to start out with a little bit of a background on these plans and the different types of plans that are out there. And these plans cover a lot of different individuals. They can cover active employees. They can cover retirees, and are very popular for retirees. And there's two basic ways that you can offer the exchanges. It's the funding mechanism, either fully insured or self-insured, or whether you offer a single carrier or multi-carriers. And so I'll go around the clock here and show you what each one of these does. If you do a single carrier fully insured approach, it's a relatively simple approach. You will get some risk transfer from your company to the insurance carrier, but it's really not offering much in the way of choice. You may offer different plan designs, but it really is more reflecting a flexible benefit program. Where you really get into the notion of exchanges is where you have something that is multi-carrier, multi-plans, and either fully insured or self-insured. And what this allows you to do, if you're in a fully insured approach, is transfer your risk to the insurance carrier. So the insurance carrier takes the risk on the insurance, and as an employer who was perhaps before self-insured, you no longer have the risk of claims fluctuation. It also allows for competition among the carriers. When you're out there and every year an employee has the choice between insurance carriers, you want to put your best foot forward as an insurance carrier. Whether that's the network that you offer, whether it's the rates that you charge, or the different features that you have in your benefits program, you need to differentiate yourself as an insurance carrier. And what we're seeing is that each year the insurance carriers in these exchanges modify their approach. So I'll give you an example. I have a client headquartered in Phoenix, and the first year of the exchange, they won the exchange last year, 2 of the 4 major insurance carriers there offered under the exchange included Mayo Clinic in their offering, and 2 did not. Now, the reason why the 2 carriers did not offer Mayo Clinic was because it does increase their costs. It is a more costly institution, even with discounts and everything. And so 2 of the carriers thought, we'll be more cost competitive if we don't offer Mayo and attractive to certain groups of employees. Well, that didn't work quite the way the insurance carriers thought, because this particular client and their employee base in Phoenix wanted Mayo Clinic. And so they wanted the option to have Mayo. They didn't necessarily go to Mayo all the time. They probably didn't go to Mayo at all. But they wanted the option that if something happened that they could go. And so in the first year, we saw quite a few people enrolling in the plans with Mayo Clinic, even though they were more expensive. And so the second year, the carriers rethought that, and now all of the carriers there offer Mayo Clinic, and the costs are still quite competitive. So we'll see how that evolves over time, but it's just an example how managed competition and adjustments are made by insurance carriers as they are in this kind of environment. Best in market efficiency. So we all know healthcare costs vary by location. And insurance carriers have different deals with different providers in different parts of the country. And some carriers have better deals in certain places than they do in others. So what best in market efficiencies is that we're allowed to offer those carriers that have the best deals or the best providers in those markets and offer those to employees and let them make the choice and balance between the cost and the providers and what they want to participate in. But the problem with the fully insured approach for some employers is that they don't have as much control over plan design. Believe it or not, benefits people love to go through all the details of plan design and determine what the deductibles and copays are and tweak those every year and how many physical therapy visits you have and all of those things. Well, in exchange plans, typically in an insured approach, you don't get that. The employee is offered the same plan designs, usually 5 different plan designs, with a choice of carriers, but the plan designs are the same for each carrier. So I'm not choosing Aetna because Aetna gives me more physical therapy visits than another carrier. So this is one of the reasons some employers don't like to go into exchanges. The reason people choose self-insured approaches is really because they want to have control over their finances. They don't want to transfer the risk to the carriers. They think they can do it better themselves. These are usually very large employers, and so they prefer to be self-insured. And if you're a single carrier self-insured approach, you're basically not an exchange, in my opinion, and you can call yourself an exchange, but you're really not. So there's a lot of projections out there as to the growth of private exchanges. Private exchanges are offered by a variety of different organizations, outsourcing firms, insurance companies, consulting firms, et cetera. And currently, hard to get a count on the number of people in exchanges. 3 million, it could be 6 million if you count an exchange in some ways. But the point is that all of these organizations are looking for substantial growth in exchanges offered by employers out there. And we hear it from employers too. So every year we survey major employers. This is over 1,000 large and mid-sized employers. And right now for active employees, about 3% of companies do offer an exchange approach. But 22% say over the next 3 to 5 years, they think they're going to go into an exchange. Now, we all know that that may change and evolve over time as the exchanges change and evolve over time. But nonetheless, it's a substantial percentage of the private employers out there who think that they may go to an exchange. For retirees, it's a little bit different. So in the retiree, and this is the post-65s, this is a Medicare market. As you probably all know, there's a very well-formed, large number of carriers and plans out there that are cost-effective, that people can choose from in the marketplace. In the individual marketplace, I can go on my computer and choose from a variety of plans. In some markets, it's 60 different plans and carrier combinations I can choose from. And so what retiree exchanges do is if an employer has a subsidy that they give to retirees to purchase retiree health care, or even if they don't have a subsidy, you can get that subsidy or you pay the full cost, and you can choose among all the different options in the individual health care market. What's unique is that you get somebody to help you through that. 60 plans is pretty daunting for most people, And so you need a licensed individual who understands these plans to help you as a retiree to understand what best meets your needs. And that's really what the retiree exchanges offer, in addition to facilitating a way for employers to provide a subsidy in a more cost-effective manner with these insured plans. Sorry about that. So why would an employer go to a private exchange? And I've had quite a few employers look at exchanges. Not all, in fact, only a small percentage jump in with 2 feet the first year. But it's been a steady rise in the number of employers who have done it. But many employers do evaluate it and either decide not this year or it may never make sense for me. The reasons, though, employers do it is they want to give choice. And they want to give more consumer tools to their employees and retirees to help them select the plans, the networks, the carriers, et cetera, and that they want that makes sense for them. Instead of the benefits department deciding those things for them, it gives them the choice to make those decisions themselves. They also free up time with the benefits department because the exchange does a lot of the work that the benefits department does. Not that you fire all your benefits department people, but they can focus their energy on other areas such as helping people in wellness and other areas. Cost control probably is one of the biggest reasons. We see, in most cases, not all, but most, financial efficiencies driving down costs for employers. So they're able to offer their employees this choice in a much more cost-effective manner. Employers are concerned to offer narrow networks, and narrow networks are networks that exclude certain providers to their employees. In an exchange, there's going to be some options that are narrow networks. There's going to be some options that are broad networks. And usually the narrow networks are more cost-effective. And this gives the employee the choice to say which program do they want to go into, which networks make sense for them and their families. But certainly employers have to consider other things. The plan designs are typically standardized. There may be a little bit choice of variation from the norm, but generally they're standardized, so you don't get to pick and choose as an employer what plans you offer to employees. You need to be comfortable with a subsidy strategy. So these plans are typically a defined contribution approach. Well, what does that mean? It means that each employee gets an amount of money to spend on the plans. Now that amount of money can vary by dependent status. It can vary by pay. But nonetheless, it is a defined dollar amount that you get. And if you want to buy the best plan, you're going to have to pay that cost difference. And that can be more substantial than what you're paying today. So if I want that platinum plan, I'm going to have to buy up to it and pay the full cost. Some employers have a little bit of difficulty with that. Others are providing subsidy amounts so that it is not that substantial for a person to buy up. But you have to be comfortable with a defined contribution approach. And of course, some companies really still want control over their plans and all their claims appeals. So these are some of the considerations, and that's why we're seeing employers take a very cautious approach into evaluating exchanges, which is the right thing to do to make sure it makes sense for them and their employees now and in the future. This is an example, and I've talked about the different ways you can offer exchanges, so I won't get too much into this, just to say that you can offer it to active employees, retirees, which again is very popular because of the robust insured marketplace and the cost effectiveness of that marketplace. 99% of the time we see that the plans are cheaper in the individual marketplace than they are in the group marketplace, which is very different from active employees. And then the third area is individuals. So if I am going to be an early retiree, that is before age 65, or if I'm just leaving employment for a few years, and I need to go access the private exchanges, what this does is helps people understand their choices within the public exchanges and help them to make a decision and use their subsidy if they get one from the federal government most appropriately. It also helps them evaluate whether COBRA makes sense for them or whether going into the public exchange is a better deal. So again, resources for people to understand all of the choices that they have. I'll just point out a couple things on this page in the interest of time, but Certainly in an exchange, what we're trying to do is give choice and give the tools to help people make those choices. So in an exchange, you'll typically see much more things that are robust, that you can easily access, that will help you make the right choice for you and your family. Whether that's the network and looking at the providers, whether it's looking at the preferred drug list to see if your drugs are on it, whether it's evaluating what you're going to have to pay out of pocket for the different plan designs at point of service versus what they take out of your paycheck. All of these tools help people make better decisions for themselves. When you first put an exchange in, we do find people want to tend towards their current designs and what they currently have, their current carrier, their current designs. But over time, we definitely see people willing to take more risk, understanding the trade-off between monthly contributions out of their paycheck and what they pay at point of service, and what the better deal is for them and their family. So very interesting. People opt down in benefits over time in an exchange and feel more and more comfortable with it. Most of the exchange options where there's a high deductible plan have the ability to put the money away into an HSA and those types of vehicles. And again, we see a bigger uptake of people because they're using the tools to understand the effectiveness and the reason why they may want to save for future healthcare costs through these vehicles. So the consumerism aspect of this is going to grow. We're getting feedback from employees and retirees. We're changing the systems to make them easier to use, hitting a lot of the points where they feel like they need the information quickly to make their choices. And then what we're doing is taking what we learned from the exchanges and doing it in other healthcare plans also. This is just an example of the Aon Active Exchange. You get a defined commitment from the employer. So the employer knows up front, based upon a certain number of employees, how much their healthcare costs are going to be at the beginning of the year, and if they're versus if they're self-funded, subject to claims experience fluctuations. So you give people standardized designs. Typically in an exchange, they're named after the public exchange. So you have the metallics of platinum, gold, bronze. It's very interesting how that really is sinking in with people, and they're finally starting to understand the difference between a bronze and a silver plan, for example. Over the years in benefits, we've called things all different names, cost plus, health plan choice, this, that, and nobody really knew what it was. And yet the metallics does allow people to really understand this is a better plan. It pays more. I pay less out of pocket with a platinum plan than I do with a gold plan. It's very simple. Then people can, what we do in our exchange and when it's insured is we have rates vary in 22 different areas. So you'll see them color-coded on this map. And that allows the cost of health care to vary. It does vary dramatically by where you are in the country. And employers can also vary their subsidy by where you are in the country if they want to. Or they can say, no, we have one subsidy nationwide and you happen to live in a high-cost area, you're going to pay more than a person who lives in a lower-cost area. It's a philosophical issue for employers to wrestle with, and they need to decide what they think is best for them and their employers. So what's happened? What do we see with people when they're in an exchange? We see them use the tools a lot. And in all the industries and all the different languages and all the different cultures, it's very interesting that we're getting 93% of the people to go online and do it. They have the option to call a customer service rep and have that person walk them through it, and they'll enter their choices for them. But people are getting so comfortable with going online and more comfortable with using the tools. So in exchanges, we see people use the tools way more than they do in a regular health plan. Everybody searches for providers. If they're not, they're not doing their job and picking a plan. They want to look at the different benefit design features. But they're also looking at medical expense estimators. So in these plans, in our plan, we're feeding their exact claims experience from last year. How much did you spend on health care? How many times did you go to the doctor? What are your drugs costing? And that helps people understand if they go to a different option, what it's going to cost them out of pocket. And of course, people really are focused on drugs and making sure that they understand if their drug is covered and at what coinsurance or copay. And then we've also seen satisfaction with choice. The number one bit of feedback we get is, I like to pick my carrier. I love picking my carrier. Then I like to pick my plan. I like you giving me the choice. And so this is resonating quite a bit with employees, and we see the same results year in and year out. These numbers haven't changed much. But that is really what people have wanted and are looking for, and they're starting to understand the differences in costs, and that is why a lot of employers are looking at this to see if it makes sense for them and their employees. So thank you very much.